Okay, we're back with Dr. Bruce Matson again, and I have another question. My girlfriend's always talked to me about periodontal disease. Tell me about periodontal disease.
Periodontal disease is bone loss. You have an infection up under the gums. The problem with that is the bacteria is in there and the bacteria is eating at your bone. The bad breath that you experience is the waste that they leave. It's imperative that you get a deep cleaning to eliminate that stuff. And then at that point, it's very, very, very important to go on a regular basis, maybe every 3 months, to get a cleaning to make sure you get that area out. Because you can, as a patient, you cannot clean up under the gums like that.
Okay, now the computer, I see that real nice computer image in the back. Tell me about your dental office and what does that do? I mean, that is really nice. You see a set of teeth on there and everything.
Well, yes, ma'am. We have we try and put our computers in each room so that my assistants go ahead and do treatment plans in the room, and we have our X-rays that show up digitally. So, so then we can sit here, we can go through each and every X-ray digitally on the computer. We could blow them up, and we can really study the X-ray and find out what's going on with the X-ray, so we can treat the patient a little bit better and just tell the patient exactly what's going on. And this is a great tool to have. Very good tool to have.
Great. Now, I see people always talk about teeth whitening. They want their teeth to be white. Tell me about teeth whitening.
Teeth whitening is a very good process. Now, not everybody's going to go from like an A4 to an A1 or B1. It's not going to happen with everybody. But teeth whitening does occur, but you have to be diligent as a patient and continue to do it, okay? Mm-hmm. And but before you start teeth whitening, you want to make sure you get an exam from a dentist to make sure that you don't have any cavities. Because if you have cavities and you try teeth whitening, you could possibly end up with a root canal.
Oh, okay. Now, what I heard you say A1. Explain the difference.
Well, basically, let's say an A4 is a pretty dark shade.
Okay.
A1 and B1 are the lightest natural shades.
Okay.
So you can increase in shade, but everybody's gonna be a little bit different. Mm-hmm. Some people do have some sensitivity with bleaching, and that's primarily because they have some recession. They have recession sometimes because of periodontal disease, okay, or because they grind their teeth, and that's another situation a person needs to look at. Sometimes people wake up in the morning, they have headaches. They don't know why they have headaches. Mm-hmm. Okay, it's because they're grinding their teeth. People that grind their teeth end up with headaches, shoulder pains, neck pains, and they don't know. They think, women especially think they need to get a massage. But the reality of it is that they're bruxers. Some people think they have migraine headaches. The migraine headaches are no more sometimes than just because they need a night guard to go ahead and protect their teeth, because their muscles are constantly working as they're sleeping at night. Mm-hmm. So what they need to do is get a night guard to protect their teeth at night and protect their muscles.
Tell me about a night guard. How is that night? Do I get it from you? Do you make them? Tell me about it.
Ours are professionally made for you. You can also buy some at the store, but they're not made properly because they're just made for every Tom, Dick, and Harry. Mm-hmm. They're generic. When you get one made at our office, professionally made, it's made specifically for your mouth, for you. Nobody else can wear it. Nobody else can fit it. And we make it professionally here at the office. And it's very good because what it does is protect your teeth. And it helps. And some people who have periodontal disease, their teeth will get loose because they've been grinding.
Wow.
Yeah.
So if I wanted one made, how long is that process? And do I put it on every night? Tell me a little about that.
Well, a night guard is to be worn at night. Now, obviously, some nights, and you know when you've been stressed out. Mm-hmm. And obviously, when you've been stressed out throughout that day, you're going to grind a little bit more at night. The process is you come in, we take an impression. Once we take the impression, we go ahead and get it fabricated for you. In other words, we get it made for you, and you come back and we deliver it for you. And basically, the delivery time is probably within 3 or 4 minutes. All we do is give it to you, talk to you about it. You take it out, you put it in water at night, and you put it in again at night. Should you wear it every night? Depending upon, you could be the judge of that.
Okay. Now, one more last thing. Implants. I see so many people talk about implants. Tell me what implants are and what is the specifics about that.
Implants are very good. Implants whatever. This is a screw that's drilled into the bone.
Mm-hmm.
That's called the actual implant. Then you have another piece called an abutment, which sticks up out of the screw, and then you have to put a crown on it. So when you go talk to the dentist, make sure that you get the price for the entire process: the implant, the abutment, and the crown. Okay. Sometimes people work in twofold. We have a gentleman who does the implant, then they put on the abutment. You come back and you get the crown. Sometimes some people do all the procedures at the same time in the same office. But the implants are very good. They take the place. Take the place of missing teeth.
Okay.
You could get a bridge, but why would you cut two virgin teeth down when you can just get an implant in the middle? So implants are really catching on, and people are starting to really lean toward implants. They're becoming a status quo, if you will, in dentistry. Then there's a cost associated with that, but I'm sure in due time, the cost will go down some.
Okay. Now, you offer all these service at your location again?
It's 8243 Colgate. That's in Houston. We're right now, a stone throw away from Hobby Airport. My telephone number is 713-644-7711.
And once again, Dr. Bruce, like we always say,
Keep
keep
smiling.
smiling.